This is critical thinking in the respiratory physiology lab. And in this lab, you're going to use your Physio XCD, but I am not asking questions totally to do with Physio XCD. Instead, I have questions where I want you to relate anatomy with physiology, as in this question. And then this is purely physiology. And then here again is one where you kind of have to, again, relate anatomy with physiology. So let's look at this first question, which asks you to identify which of the structures shown in this image are part of the dead space. And so dead space, as you know, is something where no gas exchange occurs, or is also part of the conducting zone, because all of conducting zone has no gas exchange, so it's part of dead space. Now let's identify these structures and then we'll see which belong to dead space. So the first one is A, which is this huge structure which you see here, and that is a bronchus. So that's a bronchus, because here you can see these cartilage bits here, you can see the epithelium, and hence because of the presence of cartilage, this is a bronchus. B is this one, which is a bronchiole, and this bronchiole is leading into a respiratory bronchiole. So C, this area is all respiratory bronchiole. So B is a bronchiole. You could also call it a terminal bronchiole. You don't know, you can't tell, because terminal bronchiole depends on the size. C is a respiratory bronchiole, so it's a respiratory bronchiole. And then D points to this air space here, which is an alveolus. So of these four choices, only bronchus and bronchiole are areas which are part of the conducting zone and where no gas exchange takes place. Gas exchange takes place in a respiratory bronchiole, it takes place in an alveolus. So to answer this question, both bronchus and bronchiole would answer the question. So therefore, number 6, which chooses both 1 and 2, is the answer to this question. So therefore, when you get questions like this, you must put together anatomy and physiology. Now let's look at the next question, which asks you, why is residual volume increased in emphysema, which is a type of obstructive lung disease? Now let's look at the choices. The first one says that the respiratory membrane thickness increases. Now this is not a choice, because in obstructive lung disease there is obstruction. The bronchioles are narrowed, so there is a bronchoconstriction. It has nothing to do with the respiratory membrane thickness, which is the membrane lies between the alveolus and the capillary. So obstructive lung disease does not affect the respiratory membrane, that is the one between the alveolar lining and the capillary lining. So since it does not affect it, this is not a possible choice. The second one, where it says the person hyperventilates. So if you think about it, when you hyperventilate, you remove more air from your lungs. So if you remove more air from your lungs, less is going to be left behind. So residual volume will not increase. Instead, it might decrease. So this again is not one of the choices. The third choice, which says expiration is affected as elastic tissue is destroyed. This is the right answer, because this is what happens in emphysema. In emphysema, these alveoli, the alveolar walls are broken down. So instead of having 3 alveoli like this, you will have one, which you can see the walls are broken down. So it kind of becomes one huge space with less elastic tissue. So recoil is not possible. So as the person breathes in, the air sort of gets inside this big space. And now, because there is no recoil, the air is trapped. It can't go out, or not much goes out. So therefore, more and more air gets left behind, which is why residual volume increases. So therefore, this is the right answer. And in the other kind of obstructive lung disease, which is chronic bronchitis, there the reason is different, because there it's not that the elastic tissue is destroyed. There it's because there's fibrosis of the mucosa, and mucus plugs, because of irritation, mucus plugs are formed, and that prevents air from leaving the lungs. So air gets trapped and residual volume increases, though not as much as in emphysema. And then let's look at the last statement, which says the person has tumors blocking the bronchioles. Now this could occur coincidentally with emphysema. The person could have two separate conditions. They could have emphysema, in which the elastic tissue is destroyed, And it could also be possible that tumors are blocking the bronchioles. But it does not mean that every person with emphysema has to have tumors blocking the bronchioles, and hence the residual volume is increasing. So therefore, this is not one of the choices. So therefore, the correct answer is this third one. Now let's look at the next question, which asks, which of the statements below apply to the image shown here? So first of all, you have to identify what this image is one of. And again, if you look at do your lab properly in respiratory anatomy, I send you to sites where you have to look at certain x-rays. And this is one of pneumothorax, where there is air in the pleural cavity. So because there is air in the pleural cavity, if you compare the two sides, see how much darker this side is compared to this side. This side is, not as dark. Plus, you can also see these, what are known as lung markings or vascular markings. So you can see these are the blood vessels in the lungs. On this side, you don't see anything. So that's because the lung has actually collapsed and it's lying here. So this is the collapsed lung. All of this is the pleural cavity with air inside it. And if air enters the pleural cavity, then you get this very, very black shadow. And if you can see the intrapleural pressure will become positive, and hence the lung will collapse. So this statement will be true. If the lung collapses, naturally no gas exchange would occur on that side. So gas exchange would suffer. And then in order to reinflate the lung, you have to remove the air. So that is also a true statement, because once you put in a chest tube and do what is called thoracocentesis, air gets out. Then once you remove the air, what will happen is then the pleural cavity will come back to its normal position like this, where it's going to be extremely thin, and then the lung can reinflate and get back to its normal size. So that is also true. So all of these are true. So hence this is the right answer. So again, this is one way to show you how you should think of first identify and then think what are the possibilities. And I expect that you will look at these images fairly often so that you can see the difference between pneumothorax, pleural effusion, and pneumonia.